Hello, my name is Dr. Jeff Harris. I am a psychologist in New Mexico in the southwestern part of the United States. And this is Key Strategies Training Lesson 4, Exploring Feelings Using Emotion-Focused Strategies. So lesson 2 and 3 focused on cognitive strategies. So now we're moving on to exploring emotions. And these slides were prepared by Leslie Kelly on a project with me several years ago. So emotion-focused therapy is an integrative approach developed by Leslie Greenberg, which directly targets emotional processing. And emotion-focused therapy, or EFT, combines the passive following of person-centered therapy with the active guidance of Gestalt therapy. So it's both based on a lot of empathy, but also on evoking emotional experiences. So that's what Greenberg was integrating. So one of the important concepts in emotion-focused therapy is the distinction between primary, secondary, and instrumental emotions. So at the core, so we're going to read this figure from the bottom up. So at the core of our experience, our emotional experience, are primary emotions, but they may not be recognized or displayed outwardly. And primary emotions may be adaptive or maladaptive. So our purpose in emotion-focused therapy is to help clients find primary emotions that are adaptive. So that's our target, primary adaptive emotions. Because our primary emotions may not be comfortable, sometimes we react to primary emotions with secondary emotions, which are a reaction to a primary emotion or to a thought. And then instrumental emotions are up top and are displayed to others to serve a social purpose. And sometimes when I show this diagram, people think there's always all three, and that's not the case. Sometimes we're in touch with our primary emotions, but sometimes we respond with a secondary emotion or with an instrumental emotion. So if I am fearful, I may not be comfortable with being afraid, and so my secondary emotion or my instrumental emotion may be anger. I may be angry at you for scaring me. So we want to think about those layers, and so part of our work in exploring emotions is moving from those surface layers that may be instrumental or secondary down to those primary emotions. So we also said that emotions can be adaptive or maladaptive, and let's spend a few minutes talking about this idea. So I like to ask the question, what is the purpose of emotions? And the answer is emotions have evolved to help people adapt to the environments they encounter. So the target is these primary adaptive emotional responses. So here's a quote from one of the books on emotion-focused therapy. The normal function of emotion is to rapidly process complex situational information to prepare the person to take effective action. So emotions are usually faster than cognition, and they're often to help you prepare for action. And so that preparation for action is often called the action potential. So we can see that most easily with anger and fear. So that's fight or flight. So anger helps us get ready to fight when we need to defend ourselves. Fear might help us to flee to escape a dangerous situation. So each emotion has a different adaptive purpose. So fear is an adaptive response to danger. Anger is an adaptive response to violation. Sadness is an adaptive response to loss. Guilt is an adaptive response to doing something wrong. And pride is an adaptive response to doing something well. So these are just examples. There's other emotions. But obviously, each of these emotions is sometimes helpful and sometimes not helpful. So fear is maladaptive when you're not in danger. All of us are scared of some things that aren't very dangerous. Anger is not helpful when we haven't been violated. Some people get angry at things that aren't when they haven't been violated. Sadness is maladaptive when there has not been a loss. Guilt and shame may be harmful when you haven't done anything wrong. Pride may be maladaptive when you haven't done something well. And any of these emotions can be maladaptive when they are disproportional to the situation. So let's look at those top three emotions: fear, anger, and sadness. So in some ways, we can think of anxiety as a maladaptive pattern of fear where people get stuck. Maladaptive sadness is related to depression. And anger, people get stuck in anger. So many people have a kind of a go-to emotion that they overuse. So you can think about people in your life, and some people are too fearful, some people are too angry, some people are kind of stuck in sadness, some people often experience guilt and shame. So often many of the psychological disorders that we treat are patterns of maladaptive emotions. So EFT suggests that emotions are vital in the construction of the self and are key variables in how one interacts with their environment. The adaptive value of emotions lies in their ability to alert an individual of both potential negative and positive outcomes of present or future environmental experiences. So they are a signal that you need to pay attention to something. And maladaptive emotions often involve overlearned responses from previous experiences that begin to negatively affect an individual's ability to function in their current environment. So if you grow up in a dangerous environment where you are often experiencing fear, you may continue to experience anxiety where you are responding with fear because that fear has been an overlearned response. So Greenberg suggests that psychological problems are often associated with one of four patterns of maladaptive emotions. So unresolved grief. So something sad has happened, but it's difficult to move past that grief. Fear of day-to-day stressors, so fear of things that aren't necessarily dangerous. Overwhelming guilt and shame is kind of a long-term pattern, and anger at self or others. So those are the maladaptive responses that we're going to see most frequently when we're working in psychotherapy. So emotion-focused therapy uses feelings as a point of clinical leverage to encourage multidimensional change. So in lessons 2 and 3, we saw how cognitive therapy uses thoughts and beliefs as a leverage for change. Now we're looking at emotion-focused therapy as using emotions or feelings as a point of clinical leverage. Emotion-focused strategies encourage adaptive feelings, explore personal experiences, and promote awareness and growth. So adaptive feelings help people evaluate situations, organize for effective action, and match situations in a proportional manner. So, and we talked again, I want to reiterate that we're looking to encourage adaptive feelings or adaptive emotions. So emotion-focused interventions are designed to have a primary impact on feelings and a secondary impact on thoughts and actions. So when we use experiential strategies from emotion-focused therapy, the primary target is adaptive feelings. They're in that middle circle. But when our clients experience adaptive feelings, those are likely to generalize to functional thoughts and effective actions. So today we're going to be talking about four different strategies, for exploring feelings. Focusing on feelings related to clients presenting concerns, understanding the context and function of specific feelings, analyzing feelings to determine if they're adaptive or maladaptive, and discovering unexplored emotional experiences that may be outside of awareness. And I want to point out that these are parallel to the four cognitive strategies in lesson 2. So Key strategies training is designed to help you learn these a little more easily, because the same underlying structures, the same processes are going to be used to organize cognitive therapy, emotion-focused therapy, and behavioral therapy. So in the next video, in the next lesson, we're going to be talking about changing feelings. So this is a preview. Experimenting with new feelings and helping clients overcome emotional blocks, generating adaptive feelings as an alternative to problematic emotional patterns, reflecting on emotional responses to consolidate meaning, and assessing emotional change, looking at multidimensional impact and considering a shift in focus. And again, these are parallel to the strategies we looked at for changing cognitions. So today we're focusing on exploring emotions. So Greenberg and Watson, in the book on EFT applied to depression, said that therapists seek first to explore ambiguity to understand what is occurring inside the client. They then help clients understand their feelings more clearly using techniques for enhancing emotional processing skills. So we're going to be doing these 4 strategies today, starting with focusing on emotions. So emotion-focused therapy strategy number 1 is focusing on emotions. So we're focusing on emotions related to the client's presenting concerns. So the theoretical context is that the first and most general goal in EFT is to promote emotional awareness. We want clients to know what they're feeling. Clients' ability to articulate what they're experiencing in their inner world is a central focus of EFT. So the strategy marker suggests when do we use a particular strategy. So when should we focus on emotions? When a counselor observes that maladaptive emotions seem to play a role in promoting and maintaining dysfunctional patterns in a client's life, it may be helpful to focus attention on these distressing feelings and help the client identify specific emotions. So often when, clients might say, I feel bad, or I feel upset, or I feel crappy. So in those cases, we want to identify specific emotions. Are you feeling angry? Are you feeling afraid? Are you feeling ashamed? So one suggestion is that a counselor can listen for the presence of emotional responses in the client's presenting concerns. This can be accomplished by focusing on a recent event and asking, what were you feeling in this situation? If the client says, give something that's not an emotion, gives a thought, you can, follow up with, say, when you were thinking that, what was the emotion? So the consequence of focusing on emotion is that helping clients focus on and identify feelings will lead to increased awareness of emotions, preparing clients for the future work of determining how their affective responses function in their life. So here's an example. The counselor says, how are you feeling right now as you're talking about your mother? The client says, I feel angry and worried because she is never satisfied with me. The counselor says, tell me about being angry. It eats away at me like a constant pain. I'm always on edge. It's exhausting. And again, these demonstrations are compressed for teaching purposes. Your work with clients is going to take longer usually than that. The client may not be able to identify an emotion on the first question, but in this case, we've zeroed in on the feeling of anger. So that's why this strategy has this graphic at the bottom with the X marks the spot. So I decided this counselor has helped this client identify the feeling of anger. So as a way of focusing on emotions. So the second emotion-focused strategy is exploring context and function. And so this is about understanding the context and function of specific feelings. So the theoretical context is that therapists can help clients become aware of and understand their feelings by attending to the triggers or situational stimuli that spark the feelings. Identifying the triggers helps clients and therapists begin to understand how clients construe the events in their lives and react to those events. So the strategy marker is that after identifying specific feelings, it may be useful to identify emotional triggers. So what happens before the emotion, as well as understand how emotions may be interacting with thoughts and actions. Because the overall, way back in lesson 1, we talked about how emotions, thoughts, and actions interact. So we're going to be working interactively, but here once we see what triggered the emotions, we're going to be thinking about thoughts and actions as well. So one suggestion for this strategy is that counselors can assist clients in connecting unclear or vague feelings leading to an inability to respond in an adaptive manner by exploring emotions related to life events and asking clients what happened just before and after they began feeling the emotion. So what was it about that situation that made you feel uneasy? What do you think this uneasy feeling is? The consequence of exploring context and function is that clients who become more aware of their emotions and how they function in their lives can better articulate those emotions and learn to evaluate them as they occur. The goal of this strategy is to assist clients in understanding triggers and consequences of their feelings, as well as to understand how the interaction of maladaptive emotions, dysfunctional thoughts, and ineffective actions creates and maintains distress in their life. So we're understanding emotions, but how it interacts with thoughts and actions as well. So here's an example. I feel hopeless, like things will never get better. I wonder if there are certain times that these feelings impact you more strongly. When I'm with my mother, and pretty much anytime I think about how she criticizes me. How do you act on those feelings? I don't do anything. I just feel bad inside. So here we have a new reaction from the same client. We talked about anger, but now we're talking about hopelessness. The trigger for hopelessness is this client's mother criticizing them, and then do they act on it? No. I don't do anything. I just feel bad inside. So sometimes the action is no action. Sometimes people are paralyzed. Sometimes people feel stuck. Sometimes people shut down. So a lack of action can be a consequence of a particular emotion. Okay, so now we're on to the third strategy. So analyzing emotions involves analyzing feelings to determine if they are adaptive or maladaptive. So we're back to that question of this is a good emotion or a bad emotion, which is an oversimplification. But is this a helpful way? Does this emotion help you respond to the environment in an adaptive way, or does it interfere with adaptation? So the theoretical context is a crucial distinction to be made is between primary emotions that are adaptive, which are accessed for their useful information, and primary emotions that are maladaptive, which need to be transformed. So when we find adaptive emotions, we're going to reinforce those. And when we find maladaptive emotions, we're going to try and transform them. So when should we analyze emotions? An important step in emotion-focused work is to evaluate feelings, determine whether they're adaptive or maladaptive. The goal of this analysis is to identify which emotional responses are in need of modification and will thereby lead to effective global change. One suggestion is that counselors can help clients differentiate between their healthy and unhealthy emotional responses by exploring whether emotions are experienced in a manner congruent with the situation. Maladaptive emotions may be overwhelming, avoided, intellectualized, blocked, or not expressed despite being felt. And here's going to be where you're going to use some of your empathy. We talked about empathy from being an emphasis in client-centered therapy that was integrated into emotion-focused therapy. So the congruent with the situation, you're going to use your emotional reactions as a gauge for that. So if someone is very angry at something that you don't understand that that's a gauge for maybe this is a maladaptive reaction. What's going to happen when we analyze emotions? Clients who become more aware of their emotions as adaptive or maladaptive are better equipped to reflect upon, evaluate, and make changes in their reactions to life events. Feelings which are found to be maladaptive, once identified, can begin to be replaced with more adaptive, healthy emotional responses. So here's an example. What about your relationship with your mother provokes anger? The client says, she criticizes me so harshly. Do you think your anger is helpful? Sometimes I think it protects me from her. At other times, I think it separates us. So the counselor here is using the word helpful instead of adaptive. And you may say, sometimes adaptive may seem kind of like a technical word. So I often say, do you think this is helpful or healthy? And we can make a distinction between helpful and unhelpful, or healthy and unhealthy reactions. So on this analysis, again, this is a compressed example. Sometimes I think it protects me from her. So the client's anger protects him, but it also may create a disconnection with someone, with a family member. And so obviously, in a longer example, in a real session, the counselor would say, let's look at both of those. Let's look at how anger protects you. Let's look how anger separates you. And then they would make a judgment about whether to try and, how to, if anger is seen as an adaptive emotion, we might figure out how to express it in healthy ways. If it's maladaptive, we may look for some hurt or sadness or pain underneath. Often anger is a secondary reaction to a more primary emotion. So the fourth strategy that we're going to be talking about today is discovering unexplored emotional awarenesses that may be outside of awareness. So the context here is that primary and core emotions are often accessed through differentiation and exploration of the secondary emotion, and accessing the primary emotion is the fundamental aim. So again, we're back to that idea that there's a core emotion and there may be a secondary or instrumental emotion, but we want to get to that primary emotion. So that's why in the graphic on this, for this strategy, there's that downward arrow that we're going down a little deeper to explore the more core, more primary, the more primal experience. So when should we look for these patterns? When the therapist observes that a client may be avoiding or unaware of deeper feelings, a counselor can focus the client's attention on cues and possibilities that may help uncover hidden emotional responses. So one suggestion is, in order to access undiscovered emotions, a counselor must attend to incongruence between contact and affect, drawing attention to the possibility of underlying feelings and the client's concerns. So this is why observation skills are so important. And a client may be expressing one emotion verbally, but maybe displaying another emotion non-verbally. So in the most prominent example of this is when someone's talking like they're really mad and expressing anger, but then they may start tearing up, indicating that there may be some sadness underneath that anger. And you can probably think of other examples where there's an incongruence between the verbal and nonverbal behavior. So what happens when we discover patterns? Helping clients discover unexplored emotional patterns will lead to a new experience of those patterns in the future, allowing clients to become more aware of how the feelings work in their everyday life. So let's look at one final example today. My mother always tells me what to do. I'm not a child. It's tough being treated like a child. It feels like I'm going to get into trouble all the time, and it scares me. So underneath your anger, your mother, are you feeling afraid? So again, we're looking at those different layers. And I said a moment ago that anger is often a secondary response to fear or hurt or sadness or guilt. So here we're looking with this client. The client says, it feels like I'm going to get into trouble all the time and it scares me. We also know that the client feels like they're being treated as a child. And so in this example, again, oversimplified, the counselor may now be wondering, is fear a primary emotion and that the client is covering with a secondary reaction of anger? So those are the 4 strategies for exploring emotions, exploring feelings. And so the next video, I'm going to be doing a demonstration of these of exploring emotions using some of these 4 strategies. So I appreciate your attention. I hope this is helpful, and thanks for watching this video.